Bracing versus physio. Which is better for scoliosis? One of the most common questions people ask about scoliosis treatment is, do I need a brace or can physiotherapy fix it? It is a very understandable question. Both are non-surgical treatments and both play an important role in scoliosis care, but they work in different ways. And in most cases, the answer isn't brace or physio. It's about when each is needed and how they work together. Bracing becomes most important when a scoliosis curve is at risk of getting worse, especially during growth. It's typically recommended when the curve is around 25 to 40 degrees, the patient is still growing, imaging shows progression or high risk of progression. The main goal at this stage is to control the curve and avoid surgery. Modern scoliosis braces have also evolved a lot. They don't just hold the spine still. Many modern braces use 3D corrective principles, applying targeted forces that guide the spine toward a better alignment while the body is growing. This is why bracing is often considered the most powerful tool that we have to control curve progression in adolescents. For adults, bracing can still play a role, but the goals are usually very different. Instead of trying to change the curve, bracing is often used to reduce pain, improve posture, support degenerative changes, and help people stay active. Quality of life is key. So for adults, the focus is usually support, stability, and symptom relief. Physiotherapy is also a key part of scoliosis care. It can help at almost every stage of treatment. Physiotherapy is especially useful for improving posture and body awareness, reducing muscle fatigue and discomfort, improving breathing and rib mobility, and supporting daily movement and activity. But it's important to understand that not all physiotherapy is the same. Scoliosis-specific approaches, such as Schroth-based methods or ScoliBalance, focus on three-dimensional correction. These programs teach patients how to actively correct their posture, control their breathing, stabilize their spine during movement. In other words, physiotherapy helps patients actively participate in their own correction. However, when adolescents are still growing and the curve is already moderate, physiotherapy alone is usually not enough to stop progression. That's where bracing becomes essential. The best scoliosis outcomes usually come from combining these two approaches. A simple way to think about it is this: bracing sets the structure. Physiotherapy teaches the body how to use it. A brace helps to guide the spine into a better position for many hours each day. Physiotherapy then helps the muscles, posture, and breathing patterns adapt to the corrected alignment. Together they can improve correction inside the brace, support better posture outside the brace, reduce fatigue, reduce pain, and improve the long-term stability, improving the quality of life and the activities of daily living. And importantly, they can reduce the risk of surgery. This combined approach is especially powerful when treatment begins early and is followed consistently. The right treatment plan always depends on several factors, including the cob angle, the patient's growth stage, the curve pattern, and the patient's symptoms. For children and teenagers, when the curves are progressing, a combination of bracing and physiotherapy is often considered the gold standard. For mild curves, physiotherapy and monitoring may be enough. For adults, physiotherapy is often central, with bracing added when extra support or pain relief is needed. Bracing and physiotherapy are not competing treatments. They're complementary tools. When used at the right time and for the right reasons, they work together to deliver the best possible outcomes. At Scolicare, every treatment plan is personalized. We combine 3D corrective bracing, scoliosis-specific physiotherapy, and ongoing monitoring to match each patient's needs. Because the best scoliosis care isn't about choosing one treatment, it's about choosing the right strategy for the right patient at the right time.